Hi, I'm Dr. Jenny Walker. I'm a renal physician here at the hospital and Associate Chief Medical Officer. We've created zones that completely separate the two flows of patients, and it starts right from the gate where a security guard screens everybody, sends them to the front of the hospital to a red zone tent or a green zone tent, where they have further screening and then get directed into the appropriate part of the hospital.
And you've had a runny nose, is that right?
Oh yeah.
How long has that been going on?
A month or so.
A month.
Probably all the time, yeah.
Any cough?
We've really torn our hospital apart, put up new divisions everywhere to create safe zones for our patients. So if patients are coming to the hospital, they don't need to worry about how they're going to be cared for. During the lockdown, we've converted our outpatient clinic into a medical assessment unit with 22 beds and created nearly 50 negative pressure rooms through the hospital. So those are rooms where you can get between 6 to 20 changes of the air in the room in an hour. So they're the rooms where we can do things like nebulizers and high flow oxygen. We've converted what were open cubicles in ED into single rooms. They've all had negative pressure put through. Contractors have lent us their doors from their asbestos work sites so that we've got access and we can actually open the whole thing up to get a bed out. So if you open it through, you can see we now have a single room which is negative pressure and where we can put our red zone patients. We've duplicated all of our equipment. We've purchased in quite a lot of extra equipment to make sure we've got facilities in both the red zone and the green zone to care for patients.
Do you want to have a look through those and write those
We've been doing a lot of simulation training so that everybody's ready because we've recruited in more staff. People have contacted us and come forward and come back into the workforce or volunteered to work in different roles.
I'm Karen Thornton and my normal role is Capability Specialist working with the Workforce and Development team down at Tauhora House. But for the COVID-19 project I've been brought in as Clinical Nurse Manager for the COVID-19 pathways. I think it was really well coordinated given the timeframes that we were working in. We knew we had to do it really quickly because we wanted to be as prepared as we could be for the community. It started off with working with the medical teams, the ED teams, nursing and doctors and identifying what the key needs were for the services within the medical assessment unit that needed to be developed from scratch, and then also supporting the work out the front with the tents and just a lot of building relationships and coming together and making it happen equipment-wise and process-wise.
The tradies and our facilities staff have been absolutely amazing. They've worked round the clock.
There was no oxygen available in many of the rooms, so we had 3 that were able to provide oxygen on this side, and there was no negative pressure. And given the care needs of our patients that are presenting with COVID, oxygen is a need for them as well as the negative pressure. So that was something that was done in an amazing venture over about 6 days in total, and that would normally take months of work.